Alaikum everyone. Many of my colleagues and I at the eye department today wore the color green today. And that was basically a token of association with the Glaucoma Awareness Week, which is from the 8th of March to the 14th of March. And glaucoma is basically a triad of eye conditions it's a silent blinding condition. The main symptom is the increased intraocular pressure, although there can be the kinds of glaucoma which do not increase the intraocular. So ocular means eye, so the pressure inside the eye is increased, but in one kind of glaucoma the pressure is actually normal. So I will try to explain it in as non-medical term as possible. Ultimately, glaucoma damages the optic nerve of the eye, and hence it can cause an irreversible visual loss. My pointers today are basically 3 to 4, where I want to educate my non-medical as well as medical people from other fields how to look after your eyes and be more mindful, especially in connection to glaucoma. So firstly, regular eye checkups matter. When you're getting your eyes checked regularly, especially when you do not have any eye disease, at least annually is wise if you do not have any eye problems, then that can actually sometimes detect certain diseases like glaucoma, where as compared to later on when a lot of damage is done. Secondly, I will say that do not ignore any unusual symptoms. Symptoms like sudden eye ache or an episode of blurred vision associated with, headache, eye ache, nausea, vomiting, colored halos around light, anything unusual, atypical from your daily routine in terms of eye symptoms should not be ignored. Please do remember that doctors, especially a good doctor, and eye specialist in this case, will never suggest medicines or operate until it's really needed. So, you should be mindful of that. Thirdly, something that I always tell my patients is not to misuse or overuse eye drops. When I'm consulting in the eye outdoors, many times I get an impression that people consider eye drops as if it's water. They just sometimes take it very lightly. Oh, just give me an eye drop and I'll be fine. Eye drops are medicines. They're drugs. They have side effects. Many combinations have steroids, and inappropriate use of steroids or any medication really can have long-term effects sometimes. So avoid that. Fourthly, if you have any family history, if you have anyone in your family, especially blood relations with glaucoma, then it's always a good idea to get yourself checked as well. And you and even your siblings. So that is always a good idea. I'll warmly welcome any of my audience and my colleagues to add anything that I missed. I tried to keep it very short and also informative. So I hope that you know a bit more about glaucoma now, and I hope that helps. Thank you. Allah Hafiz. Bye.